So take a wild guess. When do you think you should take your baby to the dentist for the first time? If you're thinking after the teeth come in, you are way too late. Dr. Buddy Hollowell helps us make sure your child's smile is in good shape for the long run. Dentistry is such an important part of your health and your entire family's health, especially starting with your kids. Joining us from Triangle Pediatric Dentistry is Dr. Buddy Hollowell, better known as Dr. Buddy to your patients. So when should we as parents be bringing our little guys to the dentist?
You actually want to start around age 1. The American Academy of Pediatric Dentistry recommends that children have their first dental visit within 6 months of the eruption of their first tooth. Most kids have their first tooth in around age 6 months, so that puts most kids you need to bring most kids to the dentist around age 1. Basically what we're trying to do at that first visit is establish what we call a dental home for the patient. And what a dental home is just a place where a child can get continuous dental care from a dental professional, whether that be a general dentist or a pediatric dentist, and somewhere where they can have an established relationship with the dentist if there are any problems that arise in the future. Okay,
so the first thing I'm thinking as a mom is, all right, how in the world are you going to get a 1-year-old, for example? Like my little guys didn't get their first teeth until they were 10 or 11 months old. I'm like, how are you going to look in their mouth?
Yeah. Well, that's one thing. One thing about it, these first dental visits, a lot of the kids aren't going to have a lot of teeth yet at age 1, and part of the thing we're trying to do is talk with the parents, and that's almost just as much as important as looking in the mouth. One of the things we want to do with talking with the parents is we want to establish what kind of risks their children have for developing cavities, and we basically use what we call anticipatory guidance. Which what we do with anticipatory guidance is we kind of establish what kind of risk factors the child has for.
Is some of it genetic, like if the parents had a lot of cavities?
There can be some genetic components to it, but actually most of the time in today's day and age, most dental problems are preventable.
It's lack of proper care.
Yeah, exactly, and sometimes it's lack of education on the parents' part, and just not really realizing what they need to do to take care of their child's teeth. And
there's some things like, I know that this is terrible, but my niece, you know, they didn't know about not letting the baby have the bottle in the bed, and she rotted away her teeth when she was little, her baby teeth, and so she didn't have teeth for years until her big teeth grew in.
And that happens. We see that a lot. It's actually you know, surprising statistic. It's still in this day and age in the United States, about 1/3 of kids have already had a cavity by the age of 3 to 5. So cavities are still pretty prevalent.
And that's all preventable?
Most of the time it is preventable. I mean, there are some certain special cases where it's not, but for the most part it is preventable. And that's what we like to do at the first visit, is we can talk with the parents about, you know, as I was saying, we can talk about the risk factors the child has, so we can anticipate what kind of problems they may have in the future, and then we can use those risk factors to basically determine basically a customizable treatment plan for that child, or a customizable preventive plan, so we can help the child or help the parents prevent the child from ever getting cavities to begin with.
So we'll have to make an appointment with Dr. Buddy. Thanks so much for this great information.
Yeah, no problem.